You're listening to Fast Facts Perio Edition. And now, here's your host, Katrina Sanders.
Hello, and welcome to Fast Facts Perio Edition. This week, I want to talk about veterinary dentistry. Just a short bit ago, it was time for my pug pit bull mix, Baxter, and his little sister, Olive, who is a Chihuahua Italian Greyhound mix. I know exactly what you're thinking. Your dogs are the most adorable dogs on the planet, and you would be correct. It was time for Baxter and little Miss O to go in for their routine dental visits. And it's interesting because as a dental hygienist, of course, I recognize how important, how valuable it is for my dogs to go through the sedation process and to have their routine dental hygiene visit as well as dental examination. This is important because dogs have very interesting habits, just like humans. Humans like to chew on their nails or chew on pen caps, and dogs like to chew on rawhides and sometimes their own fingernails. We also recognize that there are incredible similarities between how an animal experiences disease in the oral cavity and subsequently how humans do. So it's kind of interesting because I did the drop off and my fiance, Dale, who's one of the best dog dads in the whole wide world, went to do the pickup. And of course, he was sitting in the discharge room and saw on the wall a poster rather, of all of the different stages of periodontitis. And on this poster, it indicated with photos and a description the concerns around what happens to your animal, your pet, when an animal experiences advanced stages of periodontitis. So it, of course, is probably not a shock to all of you oral healthcare practitioners that when our pets, if or when they experience diseases of the periodontium, that this does in fact elevate their risk for systemic disease. There are incredible data points that talk about the risk of cardiovascular disease, chronic kidney diseases, diabetes, etc. in these animals if they do in fact experience advanced stages of a periodontal infection. Now, this is where we run into some interesting changes because oftentimes, although I feel like when I communicate with my dogs, they know exactly how to communicate back with me, the reality is that most of the time, unless we're taking our dogs and cats in or whatever your pet of choice that has teeth or fangs, whenever we bring our pets in to be evaluated, as long as we're bringing them in on a routine basis, an examination can be done of their mandible, of their jaw, of their teeth, the hard and soft tissues. But oftentimes, dogs, cats, our pets will also demonstrate other different types of behavioral changes that can point to or indicate that they will experience potential periodontal conditions. So in our pets, that might be changes in their appetite. They may even, you might notice some bleeding on their chew toys or their bones. Those are terrific indicators that your pet might have a periodontal infection. This is extremely pervasive. In fact, the estimation right now is anywhere between 50 to 70% of dogs by the time they turn age 3 will have periodontal disease. And that is relatively commensurate with what we see in humans. So we know that the prevalence of periodontal disease in humans is about 47.2%. That is of the average patient population between the ages of 30 and 79. We know that once our adults reach age 65 and older, that risk increases to upwards of 70%. So it's actually commensurate what we see in our pets and then what we see in humans. And the displays of periodontal disease in pets is quite comparable to humans. Now, this is where we start to look at things like genetics, age, ethnicities that can certainly stratify across humans. The same is true, for example, cat or dog breeds. And so with my sweet Baxter being part pit, and with my and pug, I guess. And then with my sweet olive girl being part Chihuahua specifically, that these are specific breeds of dogs that can present with an elevated risk for periodontal disease. So this is why, of course, we have Baxter and Miss O going in for their dental visits on a yearly basis. When we look at the statistics right now, current data indicates that about 63% of pet owners have never had their pet's teeth examined and cleaned. So it should not be lost on any of you that we know that preventive oral hygiene care, like a prophylaxis or having scaling done, is going to help to control biofilm and calculus and therefore reduce the risk of the development of periodontal disease. Why are we talking about this? Well, because new data is starting to point to some extremely concerning information about the periopathogenicity of bacteria in dogs and the potentiation of spreading these periodontal pathogenic bacteria from oral specimens from dogs to their owners. So these data points have looked at plaque specimens of dogs and their members of their family or their owners. Although I will say that as much as I think that I am their owner, they own me is probably more accurate, right? And they looked at underneath these bacterial DNA specimen, the more common pathogenic bacteria that we look at, right? T. forsythia, T. denticola, P. gingivalis, looking at Aggregatibacter actinomycetum comitans and Prevotella intermedia, as well as a few other bacteria like C. rectus, Eucordins, etc. And what we found in the results of this research study is that there were extremely high detectable rates of different types of pathogenic bacteria, the specific DNA from dogs, and that subsequent correlation to the owners who had close contact with them. We know that, for example, pathogens in the oral cavity can transmit from husband and wife or from parent to child through kissing. And now, all those sweet little kisses that I'm giving Baxter and sweet little Olive could actually allow for a translocation or transmigration of bacteria from them to me. And there's a possibility that could go vice versa. So inside of these conclusions, we recognize that these results will suggest that bacterial species can be transmitted back and forth between humans and their companion dogs, and that we recognize that it is important for the overall health of our pets to ensure that we are actively monitoring and subsequently preventing any types of oral health conditions as they might come up. So we do recognize that transmission, and we also recognize that there are preventive steps that can be taken well beyond regular dental care visits for our pets. So this is where we look at things like dental chews that can be a bit more hard or dense. Some of these can even include not just mechanical debridement, but enzymatic activity that allow for a cleaning action while the dog is actually chewing. So there are some terrific dental chews that are on the market and available. We also know that we should be practicing what we preach. So when we talk to our patients about routine oral hygiene practices, that the use of toothbrushes and different types of pastes, liquids, powders, or gels, the flavoring is a little bit different from the mint that we are accustomed to as humans to the peanut butter or beef jerky flavor that pets have. But we also recognize that some of these oral hygiene products that are available for our pets can also help to reduce bacterial loads in the oral cavity. And of course, make it that much easier for us to continue to want to snuggle up and give kisses to our sweet babies while we're snuggling up on the couch with them. It's important that we take a look at how prudent oral hygiene is, not only for those transmission concerns, but also, of course, long-term for the overall health of our pets. This has been another episode of Fast Facts, Perio Edition with Katrina Sanders. Please feel free to reach me on Instagram at The Dental Wine Genist or on my website, www.katrinasanders.com. Cheers.